Institute. Our patient, originally Cuban, presents to us with two herniated discs, L4-5, L5-S1. We're going to be fixing these two discs because he's having back pain, right? Everyone agrees? Let's see. Shot? All right, that's very nice. Now, in the beginning, I'm going to go inside and put the needle in. Shot? Once I get my needle to where I want it to be, which is the L5-S1 disc, we'll be able to do what's called a discogram. What's called an evocative discogram. Did you catch that? AP. What's going on? Oh. Yeah, I'm giving Dr. B a hard time. Our patient has really bad sleep apnea, so we're not going to keep him awake for the discogram. We're going to keep him asleep. That's going to be safer for our patient. And we already know what needs to be fixed. So it's the two discs, 4551. If you have questions, feel free to ask, Sean. So look at that. I think I can be a little bit more medial. Sean? In the meantime, Anthony, if you'd like, Sean, you can AP. Show our audience what are the 30 causes of lower back pain, chronic back pain. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You just watched the 30 causes of chronic back pain video, which goes through the disc, facet joint, sacroiliac joint, and piriformis muscle, along with fractures, tumors, and infections. If you add up all those specific causes, it's 30. The most common cause of back pain, the number one primary cause, Hector Berndes needs you, is the disc, specifically an injury to the disc called a herniation. Now, there's a lot of confusion in the world about what is a herniated disc, because unfortunately, doctors around the world use different names for the same thing. For example, you might have heard the word bulging disc. Bulging disc is a herniated disc. You might have heard the word slip disc. Slip disc is a herniated disc. You might have heard the word ruptured disc. Again, ruptured disc is a herniated disc. Protruding, extruding, ruptured, slipped, bulging, all of them are different kinds of herniation. But in the end, the God's honest truth, we're making a very simple thing so complicated, it's just all the same. It's a herniated disc. And a herniation in medicine is what you call a situation where you have a tear or defect in one type of tissue. Man, this laser is good. And this is all scar tissue right here that I'm cutting through. And I'm telling you, there's no way to get this out except with a bread knife or a laser. And we can't put a bread knife down there. It won't fit. So the laser is truly the best way. Anyway, getting back to what I was saying, it's actually the tear in the back wall of the disc called an annular tear that allows the herniation to occur. And once you get an annular tear, which is always a traumatic event, it requires trauma to get an annular tear. Once that happens, it can heal itself right away, or you can squeeze out a piece of herniation. If you happen to squeeze out a piece of herniation before the annulus heals itself, well, then you're going to be stuck with a herniation, okay? And that herniation can either be symptomatic or asymptomatic. And herniated discs are the number one reason people have back pain. Number one. Okay, number one. Also, herniated discs can pinch your nerve, called the nerve root, or irritate the nerve root and cause leg weakness, numbness, tingling. Three things: weakness, numbness, tingling. That's when you pinch a nerve root. You get weakness, numbness, tingling in the leg. You do not get back pain. What's that? Is that you with his arm? Yeah, I am. Not a problem. But we're not going to get an ulnar issue.
I'm doing my surveillance.
All right, good. So getting back to what I was saying, folks, it is this stuff right here that I'm removing. This scar tissue and herniation all mixed together with calcium, the gold stuff. This is what presses on your nerve root and causes nerve damage. That nerve damage manifests itself as weakness, numbness, tingling. A lot of people think sciatic pain comes from pinched nerves. It does not. It comes from chemically irritated nerve roots. Number one, from a herniated disc. The second reason people get sciatic symptoms is from a piriformis muscle tear. The piriformis muscle frequently tears and causes sciatic type pain down your leg. So a lot of people don't realize that a piriformis syndrome can cause sciatic symptoms. This patient, I think he has a piriformis, correct? But he wants to not treat it right now. He wants to treat it later in the future. I don't know if that's a good decision or a bad decision. I personally think he should treat it because I have a feeling that piriformis is contributing to his symptoms. All right, any questions?
No questions.
Well, there's our first disc herniation, L4-S1. Happens to be a lot of scar tissue right here. That's what we're dealing with. Tremendous amount. Right where the nerve root exits, and I'm getting the pressure off that nerve root. Let's show the audience how a disc herniation can become so painful and cause so much back pain.
Disc injuries start with an annular tear. Damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
On our video that when you have a annular tear, come on in, that annular tear allows a herniation to occur, which then creates back pain and leg pain, sciatic pain, from the annular tear, inflammation, and the laser surgery is the very best way to fix it. That's what we're doing today with this patient. He has sciatic type symptoms on the right side. He's got back pain, and I'm going to try to get rid of both by treating these two discs. Now, he does have herniations on the other side, which need to be fixed as well, and he's got a piriformis, which needs to be fixed. But he's doing this first to see how much relief he actually gets. I think he's making a good choice. This is the most important thing to do first, because these disc problems don't get better on their own. All right. Just, I don't know if it's going to give him everything he wants in terms of relief. Perfect. Yeah. You can see the tube is sitting inside the herniation now. I'm going to remove the herniation from the inside out. Have we shown the video on how the Deuk laser disc repair works?
No, we have not.
Let's do that.
Disc injuries start with an annular. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
So our video is showing you how the Deuk Spine Institute procedure is a laser spine surgery. We go in with a 7mm incision. 7 millimeters, tiny, that's a quarter-inch. And through that little cut, we spread your tissues apart. We don't cut any muscle, we don't cut any bones or any ligaments. We're not cutting anything. We're just going right through a natural opening that's already there, but it's very hard to get to. You have to have the right training, you have to have the right equipment. And 99% of spine surgeons do not have the training or the equipment to do this. So this is an advanced technique in spine surgery that requires special training and special equipment. Deuk Spine Institute, we've been doing this exact surgery for 20 years, while the rest of the world is trying to catch up. Now, the kind of surgeries that they're offering you are invasive, and you should really be very careful about choosing an invasive surgery, because number one, they frequently don't work to achieve the goals you have as a patient. Our patients want pain-free. They want to get rid of their pain. To do that, you have to treat the source of pain. And that's why we showed you at the beginning of the surgery the 30 causes of back pain, because those 30 causes are real. And if your doctor doesn't isolate what's causing your back pain, then they're going to be just treating like guessing. I don't know. Let's just do a fusion. So they're offering you guys treatments without actually diagnosing the direct cause of your pain. What we discovered here at Deuk Spine Institute is that the average patient with chronic back pain has 4 sources. 4. The average spine surgeon is now treating half of those sources. Okay? So most patients are going to have under-treatment, meaning they're not going to have all the sources of pain treated. Therefore, they'll still have pain after surgery. Well, if you're having surgery to get rid of pain, why would you want to have pain afterwards? You don't. So it's very important that doctors make the right diagnosis first. Once you have the right diagnosis, you can then select the right treatment for the right diagnosis. And each one of those diagnoses has its own treatment. There is no universal treatment that fixes all pain. You have to target the treatment exactly to the pain generator. Look here, we've got a lot of scar tissue. So this patient has herniations on both sides, right and left, L4-5, L5-S1. We are just fixing the right side today. But look at all this scar tissue he's got inside the disc. It should be 0 scar tissue in your disc. A normal disc does not have scar tissue. A normal disc that's not painful, not inflamed, has 0 scar tissue. Therefore, the presence of scar tissue is, by its very nature, not normal. It's abnormal. And the presence of the scar tissue inside the disc tells me this patient has inflammation happening in this disc. Now, when I see a lot of scar tissue, like I'm seeing here, it tells me that this disc problem's been here for a long time. When I see calcification, in the scar tissue that confirms it, that this disc problem has been here for a long time. You can see the blue stuff is nucleus pulposus. That is your herniation. That is fresh herniation, I should say. The old part of the herniation is white. What are you at, Jordan? 55? 52.5 watts. We're almost done, so if you have questions, this would be the time to ask.
We have a question.
Go ahead.
Gina on Facebook says, how do you diagnose a torn piriformis muscle? Is that something that shows on imaging?
Oh, Gina, great question. So how do you diagnose a torn piriformis muscle? Is that something that shows on imaging? Gina, the answer is yes and no. I'm sorry, it's not an easy answer. But how do we diagnose it? It's a clinical diagnosis, meaning I do it through an examination. I examine the patient's piriformis muscle, and if I find tenderness or they give me a history of pain, 2 minutes left in that muscle, then I know they have a piriformis syndrome. Plus, I know how common piriformis is. It is so common in people with back pain, like spine issues, they end up getting piriformis syndrome. So I have what's called a high index of suspicion. That's when the doctor is suspecting something based on other findings in the history, other important things that go on in that patient's life, right? So, for example, if somebody is in a shootout with guns and they come in bleeding, then there's a very high likelihood that a bullet entry wound is causing the bleeding, right? But if there's no history of, shooting guns and being shot at, then you don't think there's going to be a bullet. So we call that the index of suspicion. It means you're thinking about causes based on the history that you've been given. So I'm very aware of piriformis syndrome and how to diagnose it. I know how common it is. And as a result, I have a high index of suspicion based on where people's pain is located. It's classically buttock pain. It's in the top half of the buttock. You get muscle spasms. It can go away for a while, and like for a few hours or even days or weeks, and then it comes back. Because once it's injured, that muscle just never heals itself. It's just so easy to re-injure over and over again. So you got to know your history, you got to know the incidents, you got to know how to diagnose it on exam. That said, there is an ultrasound that can be used to see if the muscle is torn. So there are doctors that will use ultrasound to verify a tear in the muscle. I hope that answers your question. Robert? Just about done. I've got 1 minute left. You can see we're just outside the tear now. I've cleaned the whole tear. And there's some epidural fat right there, a little bit of scar tissue left around the tear. I'm going to clean that. We should be done. Any other questions?
No questions.
All right. Well, thank you everyone for joining us. We're going to leave you with one of our patients who had this procedure done, sharing their experience. We call it a testimonial. If you're having back pain or neck pain, or you know somebody who's suffering, I recommend you do the free virtual consultation. And Anthony is going to put that link in the dialog box right now. It's mri.deukspine.com. Happy to meet with you and tell you why you're having pain. And then when you're ready, you come and get it fixed. Thanks for joining us. And good morning, I'm Dr. Deukmedjian. 30 years of back pain.
Yes, sir.
Gone. Overnight.
Yeah, overnight gone. It was amazing. I've been dealing with it, suffering. If it wasn't for my faith and belief and my friends back home that supported me, my wife, I finally got here to the Deuk Spine Institute, and what an amazing experience it's been. Had surgery yesterday. I'm up walking around. I feel great. My pain was usually from a 6 to a 10 out of 1, if that. And I'm just so grateful that there are gentlemen in this world that really care about people like Dr. Deuk, and I can't thank him enough. I recommend this gentleman to anyone who's been suffering and doesn't know where to go for help. You know, I live in the state of Idaho. It's a great place to live, but probably one of the worst states to get hurt in.
Well, we are happy you're here in Florida to get your back fixed. And we did the Deuk laser disc repair on your back and the Deuk plasma rhizotomy on your facet joints. And you had a fusion done before, is that correct?
That is correct.
And we saw in your video when we were doing your laser surgery, you could see all the screws and rods, and you even have a broken screw at L5 on the left side, I believe. How do you feel comparing your fusion surgery with the Deuk laser disc repair?
There is no comparison. 100% different. The fusion didn't help me, made me worse. It gave me a heart complication that I still deal with. But since I've been here, the people are outstanding in this facility, and I can't praise them enough. And Dr. Deuk is truly a godsend for people that are suffering. I can say 100% honesty that I feel totally different person. I'm just so glad that I came here.
How does your wife feel about your new back?
She loves it because she knows I've been dealing with pain and depression. It's a hard thing to deal with. You know, it almost took my life. But like I said, with my belief in our Father and His Son, Jesus, has kept me here.
Amen.
And she's a big part of that. You know, I got to thank my friends like Dave Bowden, Dan Arnold, and Brad Russell. Those are truly my childhood friends that never gave up on me. People judge me on how I look, not how I am. And I'm a very compassionate person like yourself, and I want to help other people. I can't suggest Dr. Deuk and his team here are world-renowned, outstanding, and everyone's so kind. I'm just so happy, you know, to have you on my side, and I can't thank you enough. You know, thank you, sir.
Praise God.
Amen.
And thank you for having faith in my team and our ability to help you.
Yeah, it is. It's they're, like I said, they're world-class people here. You can't go wrong. At least for myself, I'm just ecstatic. It's, you know, can't put it into words when you have no pain. I love it, and I'm just so glad that everyone helped me who was involved with me getting here, because I didn't do it on my own. I thank you all.
Well, thank you for sharing your story. I know it means a lot to people out there. We just want people to know that we can now fix back pain, neck pain. They just have to come here to Deuk Spine and get the right treatment done, and we'll help them tremendously. Enjoy your travels home.
Yep.
And enjoy your new back.
And I shall. Thank you so much.
Yes, sir. It's my pleasure. All right.